Thank you, everyone online for joining us live today in our fourth Health Tech Thursday. Today's session is wellness, and during these unprecedented times, we need this now more than ever. Presented by the CSE and CASCOR, we are pleased to have three companies and one guest moderator. Dr. Noah Wayne, VP of Clinical Programs at NexJ. Raffi, who's going to go by one name like Prince and Madonna, CEO and founder of Liftsession, and Daniel Talmore, co-founder and CEO of Lumen. Our guest moderator is Dane Clarke, AVP Partnerships, CBI Health. Our objective in running Health Tech Thursday is twofold. First, we want to help digital health technology companies gain visibility and traction on an accessible platform. The second is to help capital markets players and investors sort through the myriad of technology companies in the space by introducing them to companies focusing on that want to gain commercial traction, and also providing new knowledge on what is happening in innovation. As for you, the attendees, share your ideas and feedback with our presenters. Leads, possible funding, due diligence, referral, and even potential strategic partnerships and relationships are all encouraged. You can find their contact information in the chat board. With respect, we might refrain from giving management advice unless we are truly expert in the company's particular field. And don't treat our presenting companies as marketing targets for services. We have some housekeeping matters. You will note a red Reconnect tab at the top of your screen. If you lose audio, just click it and you'll be reconnected. In the event that there are technical problems, we may hit restart, in which case there is no action required by you. The system will automatically reconnect everyone. We aim to run about 45 minutes to an hour. The chat board may be utilized to ask some serious questions. Please be clear as to whom your question is being addressed. We have a disclaimer that's going to be posted on the chat board because it's really long and we want to make sure that it's available for you to peruse at your leisure. Each company will have 7 minutes for their presentation with PowerPoint. When you see my face or Jason's face, that means it's time to wrap up, and they'll have about between 15 and 20 seconds. After all the companies are presented, we'll move to a Q&A. And like I mentioned earlier, we're privileged to have Dane Clarke as our question moderator. So without further ado, I'd like to introduce our first company, Dr. Noah Wayne from NexJ. Noah Wayne, Vice President, Clinical Programs, NexJ, is responsible for the design, training, and implementation of NexJ's clinical programs. He's an expert in health behavioral change and has extensive experience in designing and delivering health behavior change programs to people with a variety of health statuses and conditions at a number of large institutions that include health centers, hospitals, companies, universities, and the general public. He is a registered kinesiologist and clinical exercise physiologist with a graduate diploma in health psychology. Without further ado, Noah.
It's a pleasure to be here with everybody. Thank you so much for the invitation and for all those listening to the presentation. Thrilled to be here to speak with you today. So today I'm going to talk to you a little bit about NexJ Health and what we do and how we do it. So fundamentally, we are a technology and health services company out of Toronto, Ontario. The company was built on the concern around the rising rates of chronic disease across Canada and the world, specifically around the personal toll that they take, as well as the economic toll. And so projections of the cost of chronic disease management and prevention upwards of $40 trillion. And now over the last year with COVID-19, obviously, the huge economic and personal toll it's taking on us all is very significant. We have a focus on virtual care for chronic disease management and prevention, specifically around conditions that have a strong foundation within the social determinants of health as a root cause, as well as behaviors. So exercise, diet, stress management, medication adherence, etc. We've spent the last 12, 13 years building up a very extensive library of clinical evidence around the programs that we've designed and implemented across the country and actually across the world. We believe very strongly about the interconnectedness of wellness and the medical system. And in my review of some of the previous Thursday health tech sessions, it's come up that we tend to, in our healthcare system, it's not really a healthcare system, it's a sick care system, where we are taking care of people once they get sick. So our belief that the interconnectedness of wellness into the healthcare system to help people stay healthy and not just react once they get sick is very important. And we do that through a number of different ways, specifically around health coaching and supporting people make the health behavior changes that they need to improve their overall health and wellness. We frame this within the model of advanced virtual care, which takes a three-part aim of improving the patient experience, improving population health, and decreasing the per capita cost of care, and augmenting onto that improvements in the coordination of team-based care, again, both from a reactive and prevention model, as well as increasing provider satisfaction, and doing this within the framework of a sustainable business model. So that even in Canada, where we may not have to be out of pocket for our healthcare, it still does cost a significant amount of money. And we've developed a lot of research and clinical evidence around these interventions. And these are delivered on our platform, NexJ Connected Wellness. You can see some screenshots of it here. So NexJ Connected Wellness is a cloud-based platform that is responsive design, HTML5, CSS3, looks really sharp, whether or not you're looking at it on a desktop, a tablet, or a smartphone. We do have native apps for smartphones and tablets, so you can get the full feature set of the gestures. Now, the 4 areas within the platform to focus on, that we focus on, are specifically patient education, so being able to inform the patient or the person with lay language educational content that's easily consumable, that incorporates multimedia design, videos, interaction, as well as a library of curated content that is all person-centered, again, lay language, that can be assigned to various participants based on their condition along the way. We incorporate a large component around care coordination to provide a single source for a patient-facing care plan that overviews their entire care journey across the healthcare system, as well as their informal healthcare system, so massage, exercise, physio, etc. But their ability to also share that care plan with their extended circle of care, including family, friends, all within a structure of a lot of privacy protocols and control in the hands of the person to make it a truly person-centered experience. We have a large focus on monitoring and coaching. So we do health coaching. We train health coaches as well as and have our own coaches, as well as train other coaches. We leverage a lot of the tools within the platform to augment that coaching, specifically tracking of biometrics, so blood glucose, blood pressure, behaviors such as steps, sleep, and diet, as well as how they feel. So how they feel, mood, and psychometrics. And then the last bit, over the last year, we focused in on a COVID-19 solution, which is both a return to work program as well as a monitoring and support program for COVID-19. This overall experience is packaged in the form of programs that are tailored toward condition and delivered to the client in a very client-centered way. So when they get put into a program, it's not specifically the smoking cessation program, but the smoking cessation program gets integrated with other programs that are relevant to the client and then presented to our client or user in a single unified experience. And so it begins with an assessment where we get an understanding of who the client is, health history, background, social determinants of health, as well as current behaviors that they engage in. We use that information to personalize a program for them. So once they get into the platform, it's totally personalized for themselves. And then we start coaching. Our coaches are all regulated healthcare providers with a large foundation of motivational interviewing and cognitive behavioral therapy that support our clients in addressing the behaviors that are important to them and identifying that the client is an expert in their own health and wellness, and we just support and guide them with their own intrinsic motivations. We then design our programs around a 12-month intervention, 6 months of active coaching which is 3 months of behavior change, so focusing on SMART goals, on using the trackers, on education, and then transitioning to a relapse management protocol around helping clients continue with the behaviors that they have started, and to help them identify when they have slips and relapses to be able to get back on the wagon. And then a maintenance phase where the coaching backs off and the client is free to use the platform on their own, continue to make benefit of our online exercise programs, our meditation classes, and our health education webinars. And we're continuously doing evaluation throughout this entire process to monitor and evaluate the program. We had some great highlights from 2020, integrating AI into the platform. We have a global presence. We're currently in 5 countries around the world in 4 languages, over 50,000 subscribers and growing. We are continuously developing our coaching and virtual care experience. We've done over 1 million screenings for COVID-19 to get back into work. So in this, the employees will answer a bunch of questions and then are cleared to work with a little badge. So we actually we can say confidently that we've had 0 transmissions in any office site that our program is live in. And we're building a number of channel partners. We have some recent trial evidence and some new partners that just came on board. And just to give you a broad example of the number of not just clients that we've had, but also condition areas, such as diabetes, cardiovascular disease, mental health. We're across the gamut, and it's on the same platform, configured in different ways to be able to deliver a person-centered approach. And the other important point from this is that there is published scientific research and clinical research in all of these different areas. And I'd be happy to share the PDFs and the links to those papers at the end of the presentation. But I believe that actually brings us to the end of the presentation. Thank you very much, and looking forward to the Q&A. Thank you so much for sticking with me.
Oh, no, thank you. And for our audience, I encourage you again, not only to ask questions, but also check out their websites and see what these companies are about. And I totally agree. We have a sick care, not a healthcare system here in Canada. So thank you for that. Next up, we have, I believe, Liftsession. Let me get that up.
Yeah, can you guys see me?
Yes. And for our audience, there in the compression of the presentation, on our end, some of the words got jumbled. We can provide you with a clearer presentation upon request, but for the time being, just know this is not a reflection of Raffi, whose last name he's going to pronounce, not me. But without further ado, Liftsession and Raffi.
Thank you. Thanks for everyone. Thanks for having me. Last name is Tchakmakjian. Don't expect anyone to pronounce it right, especially even the second or third time. Of Armenian descent. So again, thank you for having me. Very much like the previous presentation, this whole concept of curative versus proactive management of one's health is really at the core of what we do. So when we started this company based out of Montreal in around 2016, our goal was to take our knowledge in the deep tech space, and I'll talk a little about our team a little later on, and apply it to something we're all very passionate about, which was the wellness of our population, of our society, but through a specific protocol or modularity, which is fitness. So you can basically get healthy and stay healthy and basically proactively manage all of that through multiple ways. And you have to really look at it globally. So nutrition is part of it, recovery, rest, stress management is part of it, but really started focusing on fitness. And that's how we really started with our market penetration out in 2016. We are very specific in how we approach the market. We do not approach consumers and users directly. We find that we're an amazing way for other institutions, other partners who are either already in the wellness space or trying to get into the wellness space to offer these services or augment their existing services through digital modalities. And that's basically what we provide. So our go-to-market is solely based on B2B. We have some amazing partners on board that I'll talk about in a second. And we have different segments of the market that basically we deliver our services to. So start off group insurance, wellness benefits, this part of the market has been on a tear. Like it started before the pandemic, where the growth was really accelerating late in 2019. But what the pandemic really forced was on them was basically the need to even implement these types of services even more, because at the end of the day, the whole work from home paradigm changed sort of how they interact with their the companies interact with their employees, with their users, and therefore fitness was and is still is a great way to not only reduce mental stress, all that sort of stuff, but also I'm going back to the previous one, but also sort of manage the whole culture of the company and everything. So corporate wellness, insurance companies, the wellness side of things, these are all interrelated, and that's a huge part of our segment. We also work with gyms. We have some of the top gyms in the world who use our platform to deliver their brick and mortar services digitally and virtually. We've recently onboarded a few universities and even K-12 schools to basically use this for phys ed perspective, and also healthcare providers. So we're talking with some patient support programs now and some medical institutions, and we're implementing with them to basically offer fitness services as a proactive way to manage whatever diseases they have, whether it's as part of a patient support program or in preparation for a medical procedure. The actual services we provide is Canadian company, again, based out of Montreal. It's 4 specific services. So we have an app where someone signs up, gets assessed, will basically build the right fitness regimen, journey, program that is right for your goals and your capabilities. We built a lot of that around science and AI, so basically combining both of them to basically offer the right type of fitness program for the right person. We have what we is our most popular offering right now from a extended upsell offering, which is our broadcast private session. So this is, for example, a company coming in and wanting to do specific fitness sessions, specific mindfulness sessions, meditation sessions, nutrition sessions for all of their employees, but really sticking it to their core employees and also building a community around it. So that's what that allows to do. We have small group, which is basically, up to 9 people, very much interrelated with one coach, and that one coach offers specific guidance, instruction, rectification during a fitness session or a mindfulness session or whatever session that's being given at that point. And then we have the top of the pyramid, our most advanced service, which is pure one-on-one coaching, where there's all sorts of, and again, fitness coaching, where there's all sorts of bells and whistles around how to conduct the session with digital fitness equipment, with digital assessments, et cetera, et cetera. So it's one platform that delivers exceptional engaging fitness services for all of sort of these markets, whether it's low budget, high volume with very specific needs, or smaller volume but high budgets for specific niche markets. So we're capable of addressing all of those. Some of our partners that use this platform that we can publicly speak about today, we've got the biggest EAP and one of the biggest benefits providers out there, Morneau Chappelle LifeWorks. We got Mercer, which is arguably the largest human resource consulting firm out there, who packages our solution and our platform and provides it to the market. We got the best gym in the world, Equinox. Again, some might argue it's the best, but we believe it's the best, and they believe that too. And obviously, with their market worth or their market cap, it's pretty much up there. So we've got Equinox, we've got Crunch, we've got Exercise Coach Franchising System, we've got healthcare institutions such as Medcan. On the insurance side, there's Lumen Health, which is Sun Life, and then there's basically some schools. The one that we prominently put out there is Avenues, which is a K-12 school, and it's pretty much renowned for being very avant-garde in the whole New York area. Some of the corporate sides that we actually get to through our partners. So we have tier 1 customers, companies that are basically using this, from pharma to financial institutions to government institutions, you name it. The overall feedback has always been, this is amazing. It helps our users engage in wellness in the right way. It's a participation-based system, not a performance-based system. It gets people to basically form a community, especially when they're virtual and working from home. And at the end of the day, it provides great value from an increase in movement and and overall wellness. So if you look at the wellness factor or fitness factor of a company when we go in, if a company's starting at around 7% or 9%, we can grow them up to 30 to 40% from that perspective. Our market, it's a huge market. Every company you're going to hear about here is a huge market. The different segments we deal with, all due to our platform and the scalability and the flexibility of it. And our main focus is really product innovation and business partnership growth. So that's about the company itself. The team itself, we've been lucky enough to have a couple of very large exits. The last one was to Dell, and the same team basically said, let's take our expertise of everything we've done in fiber optics, wireless, encryption, security systems, and build it for something we're, again, passionate about, which is wellness and fitness. Again, thank you. That covers everything I wanted to go through, and looking forward to the questions during the next few minutes.
Thank you for that. And I have to apologize to Raffi because I actually skipped over his bio, which
that's fine.
But I did let him go a little bit over. Also note that in 2013 he led and negotiated an unprecedented strategic partnership with VMware to increase VMware's based revenues from 90 million to 400 million by 2015. He's owned and managed the healthcare, education, government, and OEM verticals for cloud client computing. By the time Raffi left Dell, the business unit was generating 1.4 billion in revenue. I don't know if you're able to tell this, but he loves the startup world and is a mentor to many startups in Montreal and New York. Oh,
thank you for that.
No, thank you. And again, we encourage you to check out these companies' websites, as well as, the CSE, CSE_TV. And for this great content on not only digital health tech, but we also have a program called Health Tech Tuesdays, and you can learn more. So we are going to go on to our final presentation, which is, I believe, Lumen. Daniel Talmore, co-founder and CEO at Lumen. He's a seasoned entrepreneur, co-founder and CEO of Lumen, a company developing consumer nutrition management platform based on a small device that measures metabolism in a single breath and provides personalized food, lifestyle, and health recommendations. Lumen launched on Indiegogo in July 2018 and sold 10 Webia, a platform that offered publishers tools for integrating, managing, and tracking applications on their websites. In 2011, the company was acquired by Conduit, where he held the positions of VP for almost 3 years. Before founding Webia, Daniel co-founded another company called Junjal, a consumer online search engine. And
thank you.
Further ado, welcome to Lumen.
Thank you very much. Pleasure to be here, and thank you for taking the time. I will try to be brief on the market, and because, as my colleagues mentioned, there is a huge opportunity which is now being unveiled, in a sense. We're Lumen. We're building a device and a platform to improve the metabolic health of the world. And the problem we've been building this for the past 7 years. The problem we thought we were facing is weight loss, and we looked at the adult Americans. If 70% of them are overweight or obese, and that's a $70 billion problem. Diving more and understanding more about metabolism and really the opportunity that we have at hand, the underlying problem is way more interesting for us. It's understanding the $4 trillion of every year spent on metabolic disorders, like diabetes, like obesity, like hypertension. Those are self-inflicted disease and conditions that lifestyle and good habits can actually change. And this is our core mission. The technology we created is unique, and I will dive into it in a second. But basically what we do is we build the first ever device that can test your metabolism in real time and understand if your body is using carbs or fats as fuel. We all know about calories, but the interesting paradigm is, where are those calories that we're burning, where are they coming from? Are they coming from our carb stores, the carbs we ingest, or fat stores, or the fat we are eating? And that metabolic data is, I will claim in a second, a key for many things. So how do we perceive, or how do we measure people that are healthy, right? So if people are healthy and they're not in the healthcare system, so in order to be healthier, you need to maintain healthy weight, you need to work out on a daily basis, you know that you need to sleep well, and you need to eat healthy food, and as a result of optimizing those four, you'll become healthier. In Lumen, what we do is we flip that equation in a sense, and what we are giving our customers is basically one metric that encapsulates all of those, which is metabolic flexibility or metabolic health. And by optimizing on that compass or that GPS in a sense, you can actually, as a derivative, get your weight to lose weight and actually keep it off. You have more energy to work out, you sleep better, and you have less cravings, so it's easier to maintain healthy habits of eating healthy foods. What we've done is taking a metric from the clinical world that measuring metabolism. It was invented basically in the 60s. It's understanding the CO2 that you eliminate and the O2 that you consume, and that the flow that goes in between. And after 45 minutes of sitting down in a clinic connected to a mask, a physician would look at your data and give you the result. And for the past 7 years, we've been building a platform that can actually basically a correlating metric that can express that medical measurement in a consumer setting at home, and most importantly, in a single breath. And this opens up basically the channel to a lot of opportunities. So why should we actually measure metabolism? So metabolism is a feedback loop for food in a way. If you think about our nutrition, that's basically in the pillar of wellness, we have activity, we have sleep, we have mental, and we have nutrition, and we have feedback loops on activity and on sleep. Nutrition is still kind of the missing piece, and nutrition is really a key anchor in our wellness and in our health. Lumen will actually, by measuring Lumen on a daily basis, every morning, we will actually give you a plan for the day, how many carbs you should have, and give you kind of menus and inspiration meals on how you can execute those recommendations. You know how to fuel yourself in a workout setting and see maybe how your workout optimized basically got your body to fat burn. And after about 2 weeks of use, you will actually start seeing a new metric, which is your metabolic flexibility, that puts you on an axis between a person who is pre-diabetic to an Olympic athlete. And we have top brands already in the world exploring partnerships with athletes and so forth. I still cannot elaborate because everything is new here. But this is going to be an anchor measurement for a lot of fitness brands. Why now? So if you look at tracking in a sense, activity trackers, when they started, if you look at basically the initial brands, we can say the Fitbits of the world, it was about steps, and it was about showing the potential of people to understand and get for the first time some data about their body. And we see that market is evolving to deeper insight and to more professionalism in a sense. And we see companies like Whoop and like Oura Ring that are now owning sleep and owning our recovery and our activity. But still, nutrition is kept a marketing game in a way. We have really no idea what's happening and what is good for us and what's not good for us. And it plays such a key role. And I think now for the first time, we have an opportunity to tap into that data at a scale that was never known before. But what do we really do? Like, what the system does is we put the application in the center. We don't think of scaling and don't think about the market. As we launch, we just want to wrap the user with data and make sure that he goes through a very structured journey, exposed to the right data in the right time, and starts getting a complete picture of what's impacting. A lot of time we see people that are sleep deprived and think that their nutrition is actually not doing well for them, and kind of understanding all that data and providing an app that accompanies that with the empathy of a nutritionist, and sometimes a real nutritionist that will chat and look at your data and just give you that accountability. It goes a long way. And how does it impact people? So 60% of the people who we onboard are losing significant weight, about 1.5 pounds per week. 33% of users improved their metabolic flexibility and became more, let's say, metabolic resilient or in metabolic fitness. There is steps increase. So all of that is being measured on the platform. And in terms of figures on the company, we just started sales last year in 2020 in COVID. We are now at $18 million revenue run rate, and with 60% gross margin, and expecting sales of about $30 million in 2021. And to emphasize that it's really happening, this is the company's growth curve in device sales since September. This is a shift that we really see in consumer sentiment around this concept of understanding nutrition and metabolism. Thank you very much for having me here, and love to hear your questions, and happy to be here.
Well, thank you. Thank you not only to you, but to all our presenters. I think I'm probably going to order at least 3 or 4 of those Lumens, try them all at once. If I can lose 1.5 pounds a week with one, imagine what I can do with 4. I would like to call everyone back onto the main stage. And at this point, I'd like to introduce our moderator, Dane Clarke. And I will turn it over. This part we like to call the Inquisition. This is a Mark Francis special where we will ask probing, tough questions. They'll be fair, but they might be difficult. So without without taking up any more time, over to you.
Sounds good. So thanks all, and thanks for the opportunity, Cass Corporate and Jason, for getting to grill these 3 fine gentlemen who've done some great presentations. And feel free to put some questions in the chat. So I think maybe we'll start with you, Daniel, as you just finished off. So what was the impact you saw, or did your business shift or pivot at all as related to COVID-19? And did you see a trajectory change with COVID-19?
Yeah, so I think like everyone here, when COVID erupted, we're in breath analysis. So for us, it could have been tempting to kind of shift direction and explore this and dive deeper. But what actually happened in parallel, that we saw a need of people in curfew to take control over their health and take control over their nutrition. And so we've been getting tons of love from community and people that this was their go-to solution to understanding nutrition at home. And I see that sentiment stays. We see that in sales, and we see that with community engagement.
No, great. Thanks, Daniel. So Raffi, same question. Did you see a shift, pivot, or you sort of stayed the course?
We accelerated the course. So there was no pivot for us. I'm not a fan of pivoting. I've been through a lot of companies where pivots hurt. So I don't know, all those people who say pivot, it's not necessarily a good thing. It should not be taken as that, as such. We just saw that we didn't need to explain to people anymore the benefits of fitness in a digital format. So obviously there's a lot of other things going on from the B2C space that was helping out. But what ended up happening is the pandemic forced people to try stuff they would never think would work in their world, which is instead of going to a gym or working out at a gym or trying to work out at home. And basically they saw that it works just as well, and it's more convenient and more efficient than most of the time going to a gym or working out from there. So that pretty much accelerated our roadmap of sort of like hitting our sales for 2022. We hit them in 2020. We basically added a whole bunch of new features, again, in an accelerated way because of COVID. And one of the things that really helped with is the messaging and evangelization part of it, especially into the corporate and sort of like B2B world, which is, I used to start meetings with starting to explain why this works. I just don't need to do that anymore. Everyone understands why it works. And basically we go straight to how we can help in, partnering deploying with our partners. It's been good for us. I can't say anything but that.
That sounds good. So I think, Noah, over to you from the same perspective. I heard you mention the COVID screener, so I think that was a little bit of something additional that maybe you didn't anticipate, but similar concept and question.
Yeah, no, I echo what my colleagues are saying. Before digital health was a much more difficult sell, especially to the clinical community. But then as soon as COVID happened, it became a necessity. And everybody was like, oh yeah, all of the issues or the perceived issues around privacy and accessibility all of a sudden disappeared when there was no choice but to go digital. So that changed the conversation a lot. Also, we didn't pivot, but we added a new offering from a programmatic point of view to our platform and configured a COVID solution, 2 COVID solutions, made one of them more available to companies where they needed essential workers to come back to work. And so we configured parts of our platform to be able to screen people for potential exposure to COVID, and then be able to give them a badge to see whether or not they were clear to go back to work or not. And if they're not cleared to work, literally there's a moving GIF that shows up on their phone that says, no, they cannot return to work. And they would literally get turned away at the door if they were trying to show up, but also let in if they are clear. As well as we did start a direct-to-consumer initiative, making it actually freely available for people to be able to monitor for COVID signs, as well as get trusted information around COVID. And anybody can sign up for that even now, just going to the nexjhealth.com website, and you get some light health coaching, but access to a lot of information.
No, that's great. So thanks. I think, Daniel, coming back to you, there's a question in the chat. So thinking about, when you get into the diagnostics and, you're thinking about the 1-minute breath versus, the blood glucose, the long test waiting rooms, has there been any resistance? So why, that market with doctors and, moving it into that space?
Yeah, to be honest, we were aware of that resistance from the get-go, and while looking at who is this product for and who will advise, like how will that product get to market, we decided that there will be more pull from the consumers actually to know, and it will be harder to educate the doctors in a way and to teach them why it's important. And for that, this is why we built that device from the get-go with the consumer in mind, and we've done customer discovery, and basically we're building the features and the extensions of that platform based on consumer feedback and sentiment. Having that said, now that healthcare is starting to become more aware and to care more about these types of solutions, even if it starts only with employers, it becomes an avenue that we are pursuing, but still it's having the consumer in mind, and gradually we're adding professionals into that platform. But eventually it's solving the consumer, because it will make everything else, every other layer, every channel, to become way more efficient to scale.
I think sometimes once the consumer, others follow, right behind. So for sure. So Noah and Raffi, thinking about something you talked about, that proactive healthcare, and I think more and more we're seeing that shift up. Let's fix it upstream before they get into the hospital. So is that some of the philosophy that you think about when you built out your network and your apps and those partnerships? So say, let's keep people healthier in the communities, in their homes, so we don't have them end up in hospitals. How do those conversations go?
Yeah, I can start. 2017, they didn't go that well. It was not a priority. 2019, we saw a big shift. Have to give big. I respect what Morneau Chappelle did, because they took a big chance initially, and they did a big deployment with us to all of their population, putting a bet that proactive management of health was going to be top of mind in the future. And that's what ended up happening. So what we saw is in 2019, right before the pandemic, there was this growth curve that started, where people started looking at investing in that, especially on the corporate side. And that's one of the reasons we went through the corporate. We tend to follow market pull, right? So just like for Lumen, the market pull starts off with B2C, and then it will eventually go into B2B. Same thing, we saw the corporate on the proactive side really starting to engage around 2019. And then basically right now it's of top of mind. I would say mental health is the first thing people look at right now. And then anything that has to do with wellness, what has to do with fitness, nutrition, everything, you know, is related and is right after. But the beauty about the fitness side as well is it affects mental health so much. So we get coupled with that too. And so long story short, start off very difficult conversations, very difficult to explain and get people to put this as a priority. Everyone understood it's important, but not a priority. And then over time, things shifted over so that this becomes a priority.
No, makes sense. Noah?
In 2017, we actually responded to an RFP from the Heart and Stroke Foundation in Canada. They were looking for an organization to design and deliver an intervention that was actually focused on prevention. So heart and stroke is all about, you know, cardiovascular disease management and prevention. And they received a health innovation grant paid for performance through the Public Health Agency of Canada to try to identify people who are pre-hypertensive. So before they actually go into the healthcare sick system with hypertension, to develop a community-based program that helped people engage in healthy behaviors and help to stop or reverse the trend of blood pressure. And so we've been preaching this for a while, and like everybody else has. We've been able to put ourselves in the position with some large foundations like Heart and Stroke to be able to roll this out. And we had about 5,000 people across Canada enroll in that program. It's called Heart and Stroke Activate. It just wrapped up in 2020, and it's going to be published quite soon. And last year we started a project with the Canadian Cancer Society along the exact same lines. Again, through these foundations, focusing on a prevention model as opposed to a reaction model. And so Canadian Cancer Society is going live with our software targeting prevention of breast cancer through health behaviors.
Gotcha. So Daniel, maybe I'll give you a chance on that same sort of proactive. Any thoughts on, you know, on that piece?
And taking a proactive approach of companies and in terms of how you can treat your employee at home and how you can make sure that when he's off the cafeteria and when he's off his friends, he still adapts the at-home caring, and platforms like my friends are suggesting here as well will be on the rise. It's evident, and it's for everyone's betterment in a way.
For sure. Uh-oh, I see Barrington.
We'll take one last question.
So one last question, maybe I'll make a data question. So when you thought about your data and as you're moving into these different platforms, have you seen a shift in what you anticipated with your data? And if you could answer that quickly, going to Barrington.
So I can start. It's so our data is so unique. We really knew that it's on us to really figure out the opportunities within it. We are today the biggest metabolic platform out there. There was never a year that so many metabolic measurements were ever done. So the opportunities are just popping up within. So understanding women's on their monthly cycle, for example, the changes in their nutrition in the different phases. Understanding again how sleep and sleep deprived and stress is actually impacting weight gain, and that can be foreseen even in advance, even before the weight gain really appears. There is abundance of opportunities, and it's basically on us to discover and expose them and to work with partners on that. So,
sure, thanks, Daniel. Maybe Raffi, over to you quickly, and then Noah.
Yeah, I second that. Basically, there wasn't any new data per se. There was tons of more data than we were expecting initially, which was great. So which allowed us to accelerate a lot of our product strategy at the different types of hooks we want to build into the system. But yeah, it's the opportunities out there. The more data you get, the more correlation you find between different things, and the more you can build off of that.
No, for sure. So over to you, Noah, for last words.
So in our platform, any engagement is everything is, you know, there's always a trail of everything, and we use that data to help inform the delivery of our program. So identifying areas of struggle or areas of disengagement to then literally in real time during the program adjust the way we deliver to support higher engagement. But we do have a fundamental philosophy that the data is owned by the client, and so the person is in control of their data. They can have their account deactivated and destroyed, and they can also opt in to be able to share that data for research and for anonymized use, but they can also opt out of that. So data control and privacy is a huge component of what we do because we're also working with medical data.
For sure, makes sense. And there's the hook. I see Barrington.
Well, I'm not. There was one more question that came in, but I felt a little awkward asking. It was for Lumen, and they said, "Do you have any plans of going public? And you should go on the CSE and all about the CSE." That may have been a plant that somebody put in there. I don't know. But somebody did ask if you're going to go public or have plans to.
So yeah, it's it's an avenue. It's not all our focus now is getting to the market and improving the product. If we can still keep ourselves private, I think it's smarter for the company at this stage. But
hey, don't let me sway you. I'm just gotta love it. Thank you to our moderator, Dane Clarke, AVP Partnerships, CBI Health. And thank you to our presenters, Dr. Noah Wayne, VP of Clinical Programs at NexJ, Raffi T, CEO and founder of Liftsession, and Daniel Talmor, co-founder and CEO at Lumen. May you have continued success in expanding your businesses. Thank you to our attendees for your time today. Go to the company websites and learn more about these companies, as well as previous sessions on Health Tech Thursdays and Tech Tuesdays. If you have a lead for them, connect with them. Check us out next week. We are doing virtual mental health. This is, there's been a big emphasis on mental health and more so talking about mental health and getting rid of that stigma. Let's talk and let's learn more about it. And with that, I would also like to say thank you on behalf of Jason Boboikis from CASCOR. Again, he is one of the founders and organizers for Health Tech Thursdays, and as well as Mark Francis for being the overall inspiration for bringing companies, both public and private, to you, the investor, and the capital markets. With that, I'd like to say goodbye and stay healthy and stay safe.